if the patient has taken upon himself or herself to do the lifestyle changes and continues medication regularly and visits their doctor from time to time to check themselves up, uh, the risk is quite less. Also, then about post heart attack care, you should always be regular with your medications. You should always be regular with your checkups. Even if you have to start with some kind of exercise, you should always, first of all, consult with your doctor and then you start it gradedly. So, every time you exercise, it has to be done with a warm up so that you don't straight away go up to a gym and start picking up weights. You can start gradedly. Start with small walking. Start, then you can go into brisk walking. Then you can increase the time till you can walk or the distance till where you can walk. But anything that at that point of time is causing you distress is not supposed to be done. So in post heart attack care, all the lifestyle changes that I've said have to be made and medication has to be taken very seriously. A patient presenting to the hospital, say within an hour of an heart attack, would do better rather than somebody who's coming after, say, about 24 or more than 12 hours. Because the problem happens is that the heart attack happens and the vessel which is supplying your heart is blocked. The time we take to open that vessel is equivalent to your heart muscle. So I'll explain it in this way. So as the amount of time that goes by when a patient starts developing a heart attack to us opening his vessel or giving him full free blood flow to that part of the heart is going to determine the outcome of that patient over the years, because the heart muscle is continuously dying if we are not opening the vessel. So we have to, all these people with heart attack, the earlier they present to the hospital, the better for them in terms of their further prognosis. After heart attack treatment, if you are experiencing any kind of chest pain, first thing in your mind should be to go to the hospital. That reach the hospital, don't try to self-medicate, don't try to wait for the pain to go away, because a lot of people do this, that they wait for the pain to go away and they come the next day, and which again gives them a really bad prognosis or can lead to complications. The complications that occur after a heart attack are many. So you could have heart rhythm problems, you could have heart function problems, wherein, like I said, if you are presenting late or you have had some amount of damage to your heart function might be suffering a little. So all this can be dealt with medication. There might be problems with your heart rhythm, which might need to be corrected. So like I said, cardiac arrest is also a complication of heart attack. So, these can be dealt with, but there has to be some medication which has to be given, or some of the other. We have certain devices now that complications of heart attack sometimes our heart rhythm uh, goes in a different direction and the patient suddenly loses consciousness. So to prevent that, we have certain devices. It's called an intracardiac defibrillator, so which has to be implanted inside the heart. Lifestyle changes are very much necessary. Continuing your regular medication is very much necessary, and also regular checkups. And so that, with regular checkups, you are investigated each time for different things like, how are your lipids doing and how is your medication affecting you, checking your blood pressure and checking your heart rate, getting an ECG done. So all these things will tell you that whether how well you are doing on the medication or not. Ideally, there are no such restrictions, but you have to be regular with your medication and you have to introduce the lifestyle changes. The restrictions would be, like I said, you do not take high sugar foods or high carbohydrate foods, which would be a Western diet. Or I would say most of the patients I advise to take preservative free food. Take fresh foods like fresh vegetables. If you are a non vegetarian, you can take chicken and fish, but avoid red meats. So, red meats are one thing that need to be avoided in patients who have heart disease. eat green leafy vegetables, decrease the amount of sugary foods that you take. Sugary food does not mean just only chini and sugar, which is used in our daily diet. It means also foods like chapatis, breads, which have a very high carbohydrate content, even preservative, even anything that comes in a bottle, or even high salt pickles that we use are not to be used by such patients.